All right. Good morning, everyone. I'm here today with Ariel Gallop. She is a pelvic floor physical therapist that I actually went to see recently, and I learned so much about my own health and what also is possible for men struggling with bladder or prostate issues that I asked if she would come on our channel and share with us her knowledge. So welcome, Ariel.
Thank
Could
you
you
very much.
Yeah, could you tell us your background and your experience?
Yeah, so I am a pelvic floor physical therapist, which means I am a physical therapist. I went to 4 years of college and then 3 years of PT school, and then I specialized in treating the pelvic floor. So I treat pelvic floor diagnoses like urinary issues such as leakage or frequency or feeling like you have really bad urgency. That might be due to prostate issues, having a prostate surgery. That can be due to cancer surgeries. I also work with constipation or diarrhea or pain with urinary issues or bowel issues, and then other sexual dysfunctions like ED or pain following intimacy or during intimacy.
And then for women, you help women with those same things and also painful intercourse or
Yeah, so I treat all those same things in women. I treat people that are pregnant and postpartum. I do work with a lot of painful intimacy. So whether they have pain during sex, after sex, both, I can work on all of those things so that they can have pain-free intimacy and pleasure.
one thing that really surprised me was how easy it was to talk to you because right off the bat, you asked me things like, how often do you urinate? Do you strain when you urinate? Things I had never thought about. And what does your poop look like? And you had a diagram of different poops and like point to the one that's yours. And so I'm like, oh, I guess we can just talk about this. You made it
Yeah.
seem like someone was asking me what kind of, broccoli, if I like broccoli more than asparagus.
Yeah, that is fair. It is very medical, and I do ask very medical questions, but I try to ask them in a way that you're willing to be open and I have the time. Each session is a minimum of an hour, so you really get the time to hopefully know me a little bit and feel comfortable telling me about what your poop looks like and what you do during intimacy. So, yes, but we do ask all the questions.
Yeah, and you asked me some things I'd never considered, like, do you strain when you urinate? Do you strain when you have a bowel movement? And I realized that I do because I'm trying to rush through it. And you recommended, I brought it. I ordered this on Amazon, the potty.
Yeah, you're the
Yeah.
squatty potty.
And what's the purpose of this?
That is a good question. Let me pull up. So I have my pelvic model here. When you sit on the toilet, in general, try to go to the bathroom. You try to relax your pelvic floor muscles. There's a muscle in here, kind of around here. Everyone has it. It goes around their anus and it attaches to the front of the pubic bone here, called the puborectalis. And its purpose is to kind of hold everything in. But when you're sitting on the toilet, sometimes it kinks the rectum, so you're not able to poop as well. But when you get your knees up higher, then you're tilting the pelvis like this, and that slackens that muscle a little bit. So that helps you poop a little better.
Yes. We also talked about just, I'll just share some of my own things that I learned. You asked about how often I urinate. I said more in the mornings, and that could be related to drinking coffee because that creates more of an urge to urinate, not in a
Mhm.
bad way. And
Right.
then you suggested instead of gulping water, taking little sips. What's the benefit of that?
When you sip water, your body can use it more efficiently. So your kidneys aren't feeling like your system is flooded with water and it doesn't need to immediately get it out. So if you sip it, your body will use it more efficiently and not need to get rid of it. So, yes, I'm a big fan of sipping and not gulping. And then if you're going to have something like coffee or tea or something that might irritate your bladder, typically, if you have water and then that irritant, and then water and that irritant, then that can help you not have to pee as often, which is something I work with a lot of people. A lot of people are going pee a lot, and we can help decrease that to a healthier, less limiting amount.
I did notice that I started sipping my water and I don't have to urinate as often.
I'm so happy to hear that. I'm so
Yeah.
glad.
So is that the main problem that people come to you with is the having to urinate frequently?
That's a big problem. I would say that most people come to me specifically for pain with pelvic pain in general, whether that's pain with intimacy or bladder pain, pain in the penis, anywhere. I typically just treat pain. Um, in general, pelvic therapists can treat urinary issues and bowel issues, but I mostly am treating the pain stuff.
Okay, so I guess for women, let's start with the women. Since I'm a woman, yeah, and then we'll talk about the men. But a common problem for women is, say, a urinary tract infection.
Yes, that is definitely a big issue for people. It can be affected by what they're eating, what they're drinking, what they're washing with, if they're using maybe aggressive soaps, and also what kind of underwear people are wearing. So we get into the nitty-gritty of, okay, what are you wearing? Is it lacy? Is it maybe a thong versus a full butt covering underwear? We kind of get into it to figure out, okay, what are contributing to these things? One thing that I think is very interesting is some people think that they're getting UTIs, but they're actually getting symptoms like that of their pelvic floor muscles are really tight and it feels like a UTI, but it's not a true UTI. And so when that's the case, then as a pelvic therapist, we work on that to lengthen those muscles so they don't have the tight muscles and they have less of those symptoms. That's not always the case. Sometimes people do have a UTI, but sometimes it can be the muscles. And then another thing that I often talk about is that decreased estrogen in women can really affect their urinary system. And if they have decreased estrogen, then they might get more UTI. So that's something that people get prescribed a lot in perimenopause and menopause to help prevent that.
Interesting.
You know, right?
So other problems that women have, I mean, just what I know about is they have pain during intercourse.
Yes. Yeah, that's one of my favorite things to treat because I think it can be such an empowering experience. So you have, and I know you've talked about this on here before, you have three layers of muscle in your pelvic floor, men and women do. The first one is the one that you see here, the most superficial, here, 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 and then here. And then the deeper third layer is this pelvic bowl. And these muscles, either the first layer or the third layer, and sometimes the second, but mostly the first and third can get irritated if they're tight, and then
Okay,
that can be
wait.
painful.
Before you go on,
Yeah.
for those of us who are like very ignorant about this, can you slow down a little bit on this model and where this all is in our bodies?
Yes, sorry. Yes. So this is the pelvis. Let me get it attached. She broke off. Okay. You have three layers of muscle in the pelvic floor. So this is the front of the pelvis, this is the back of the pelvis, and then the three layers of muscle. So the first layer is here on both sides,
We can't
here,
see this. This is all like
external or internal. Yeah, covered in skin.
where is this in relation? Okay, the blue part is the clitoris.
Yes, here,
So the muscle is underneath or to the side?
around it.
Around it. Okay.
Yeah. So these are the bones that you sit on. So if you're sitting, this is what it looks like. So the first layer of muscle is here and here and here and here. So obviously this one is holding in poop. And then this is a supportive muscle. When people give birth, they can tear in that muscle. So that's a common thing that I treat, and that can be painful. And then these muscles, their main function is to bring blood flow to the clitoris right here. So that those muscles need to have good mobility and good blood flow so that people can have pleasure and not have pain. So that's something that I address with a lot of people. So that's the first layer of muscle in women. I have my male model. I know we're not talking about men just yet, but the in general, the pelvis is the same. This is the front, this is the back. Obviously, there's something here that was not in the other model, but the muscles are the same for the most part. So this muscle along here is the same as this muscle right here. They're both the same name, same function of bringing blood flow. It just looks a little different on the male model versus the female. But that's the first layer of muscle. The second layer of muscle is more responsible for bringing blood or bringing urine from the bladder out. So around the urethra and holding everything in. So when people have leakage, often it's that layer of muscle that's affected. So layer two. You can't really see it in this model, but basically around the urethra here or around the urethra right there. And then the third layer of muscle is the bowl. And this is the deepest layer. So it starts on the back of the pubic bone here and it goes around the anus. It can attach to the tailbone. And then these are hip muscles. And they play a big role because of their proximity. They really do affect the pelvic floor. So when people have tight muscles or they have a hip injury, that often can affect intimacy, but also they might have just pain in general in their pelvis, and it's coming from that hip muscle. So those are the muscles of the pelvis. And though the pelvis is a little different with a little bit of different mechanisms in a male and a female, they do all work for the same function of holding everything in, holding in pee, holding in poop, holding in the organs, and then having pleasurable and pain-free intimacy. And I work on that a lot, the intimacy for people. So if someone has pain with initial penetration, that's often this first layer of muscle that's affected. If they have pain with deeper penetration, it's often this third layer of muscle that's affected. And then if a male has pain following intimacy, it is often these muscles in the front here that are affected. So we can work on those internally or externally to make them not as tight.
So I heard you say blood flow. So obviously, the blood flow is super important to enjoying sex. Like people have to have good artery health, good blood flow.
Yeah,
And you also talked about the muscles could be too tight, or they could be maybe they're not tight enough.
yeah,
Something that I had never really thought about. Because I work out and I'm like, I think that helps me with my libido. It's got to help because it makes the blood flow better everywhere.
totally.
But then the tightness and the relax, because women were always told to do these kegels, like,
Hmm.
oh, we want to have that tight vagina. We want guys to go, oh, your pussy's so tight, right? But uh, the reason I came to see you is because I have a friend who told me she went to a pelvic floor specialist and she learned that she had to relax her pelvic floor and that she actually had more sexual pleasure when she did that. So I was kind of curious.
Yeah,
But I'll let you continue about the pelvic floor and the muscles and the blood flow.
yeah. Well, so a lot of times people, yes, I think generally women are taught that we need to strengthen our pelvic floor. I think if you asked 10 women on the street, nine of them would say, oh, yeah, I know what a Kegel is and I know how to do it because we're kind of taught how to do it and that we should do it. That is not necessarily the case. Like you were saying with your friends, some people, their muscles are too tight and it's not in a good way. It's not in a pleasurable way. It's in a way that we want our muscles to move. Like if we're talking about our bicep, we want it to shorten and we want it to lengthen. The same thing happens with the pelvic floor. We want it to be able to lower as we do certain activities, and we also want it to contract as we do other activities. And it really does that during everything, whether you're walking, running, lifting weights, having sex. We want those muscles to have that full mobility. And if they don't, if they are too tight and they're up and constricted, then you're not getting that length. So you're not getting appropriate blood flow. You're not getting good nerve innervation. So you're not feeling things as well. And you don't have the mobility. So you might not be able to do what you want with your legs. You might not be able to get things in as deep or in at all. So that's a big part of what I do with people is showing them stretches that they can do and then ways that they can release their pelvic floor. Um, I don't remember if I showed you these, but this is a device that people can use to release their pelvic floor in the deep layers. So you can use either end of it to go, you can go intravaginally, you can also go intrarectally and release the muscles if they are tight and if they are painful so that they don't hurt as much. So this is a pelvic wand. And then there are also dilators that you can use for the same purpose of stretching the pelvic floor muscles so that you don't have pain. And this is really helpful when women have pain with initial penetration. Most of the time, these people have had pain every time they've had sex, but sometimes they have things happen and it develops later in life. This is really good when people have that hip stuff that I was talking about, like tight hip muscles that is contributing to their pelvis being tight and painful.
Now, how does that help? The woman puts that in her vagina? It's just for women, right?
No,
Or
so they
does it go?
actually, you can. What I typically tell people, and this isn't a hard and fast rule, but typically this side is vaginal and this side is rectal. But you can use it either way.
And then, so putting that in the vagina relaxes the vaginal muscles, or?
hmm Yeah, so this one you can really do a good deep trigger point release so you can get in there and find the muscles that are tight. And it might be that they're painful, or it might be that your pelvic therapist has said, oh, this doesn't move as well as we want it to. And so you basically can insert this in and work on those muscles. And then this is, you can use it vaginally, but you can also use it rectally to get towards the deeper muscles, like by the tailbone to release that. So I see a lot of people that have tailbone pain, and we're working on releasing those muscles in that way.
Oh, tailbone pain, not lower back, but tailbone.
Yeah, I mean, it can be both, but a lot of times tailbone pain is relieved with that kind of work.
Wow. Okay. So, so for women not experiencing sexual pleasure, the muscles can be too tight. When I was at your office, you also mentioned that the outer layer, if it's too tight, can prevent a woman from being able even to have orgasms, even from masturbating, because the
Yeah,
muscles are too tight. Would you show again the things
yeah.
that can come up for women as far as muscles that keep them from having pleasure? Anything we haven't covered yet?
Yeah, I mean, I can go a little more in detail. So, in general, this is the clitoris, and then these are the other legs of the clitoris, and they are it's a ton of nerves. It's a big bundle of nerves, and that is what gives women pleasure with intercourse. When we don't have good blood flow to those muscles and those muscles are tight, then you're not getting as much feeling in those nerves of the clitoris, whether that's along the legs here or along the head of it right here. And so we want to make sure that those muscles are stretched out. If they're not moving well, then you might not be able to have an orgasm. The other thing is that sometimes when people have pain in general, it might not necessarily be that layer of muscle. It might be in the deeper layers or even in the hip muscle. But if you have pain, you might not be able to have an orgasm, regardless of if these muscles are fine. So, really, my main goal is to make sure that people have good mobility and good blood flow so that they don't have pain and they have good blood flow.
What would a woman do to make sure she has good blood flow in these muscles?
That's a good question. I think movement is really important. Like you were talking about, you exercise, and yes, you exercise a lot. I think movement is good, whether that's walking, whether that's lifting. People do a lot of Pilates. Any kind of movement, you're getting good blood flow in the body, and that's helping, like you said, with the arteries. I think walking is one of my favorite exercises for the pelvic floor because I see it help people that have a tight pelvic floor or have a weak pelvic floor or both. So that's my favorite movement for people.
And what about the muscles on that? Because they should be relaxed, right? Because sometimes they're too tight. That's a problem for a lot of women. It's too
Yeah,
tight, right? Like, are they
yeah,
holding tension, or they've done too many Kegels, or that's where they hold their tension?
yeah, definitely. Definitely people hold their tension in their pelvic floor. They can hold their tension in their jaw, and because of the connection of their jaw and their pelvic floor, they might have more tension in the pelvic floor. So we work on a lot of, I call it down training or down regulating the nervous system of how can we get your body to relax with breathing and with stretching and really intentionally thinking, okay, I can pay attention to where I'm sending this breath. I'm breathing into my vagina, I'm breathing into my butthole, and I'm lengthening those muscles. And that brings good awareness, but also good blood flow and mobility.
And that is the opposite that I've ever read in any sex books. It's always
Hmm.
about tighten those muscles, do your Kegels.
Yeah,
And that's just contributing to more tightening, it
yeah,
seems, if you
yes.
don't
And
also relax it.
yeah, and there is a time and a place for Kegels. Some people it is appropriate. Some people really do need okay, I'm gonna close and I'm gonna lift, but some people don't. And I think we're in a place as a society where everyone's been told to Kegel. I have male patients that were like, yeah, I have a lot of pain because my doctor told me to Kegel. And I'm like, well, that was not what you needed. So I think we're in a time where we need to find the middle ground of yes, that is good for some people, and yes, that might not be appropriate for you. So I don't want to hate on them too much. They are good for some people.
And also, yeah, and even if we do the Kegels, so also that we have to be able to relax those
Yes,
muscles.
spot on. Yes, exactly. You can't hold them in that squeezed position.
So one thing that I learned that I did not know was part of what we did in my visit was you did a pelvic exam on me,
Hmm.
and you said that you would feel around that third layer.
Hmm.
And I was confused. I'm like, okay, if you do the exam and you're feeling, around my vaginal muscles for tension there, but how are you going to feel in my pelvic bowl? Like, how are you going to get there? And you said through your vagina. I'm like, not that that's attached to my cervix. Like, it's a closed thing. It's a vagina, cervix. How are you going to get into my pelvic bowl? And you said there's actually a gap between the end of the vagina and the cervix. It's like not attached. I didn't even know that.
Yeah. Yeah, it is. It's totally not attached and it moves with different phases of your cycle. So sometimes it's lower and sometimes it's higher, which can also affect people having pain with intimacy because sometimes they feel their partner hitting their cervix and that can be painful. And they might not feel it all the time, so it might take them a while to figure out what is causing that. But yeah, there is a gap. So I go around the gap and I kind of, if this is your vagina, I go around it and I reach to the rim of the pelvis and then I'm not hitting the cervix. I can reach for the cervix because sometimes I want to see how does it move, but in general, I'm looking at the muscles around everything.
Yeah, the cervix thing is interesting to me because I noticed that for myself, depending on the position that I am with my male partner, that it can hurt sometimes.
Yeah.
Yeah, and but if I really know the guy well and I'm really relaxed, like I had an experience with someone who was a little on the longer side and it kind of hurt. I couldn't do the doggy position, but then I got to know him. So the second time I was with him, I was relaxed. I was turned, and my body responded completely differently.
Hmm.
So I was like, okay, that was interesting to me. So the the way I think that maybe it's for a lot of women too, like if I feel safe, if I trust, if I feel connected, I'm going to be more turned on, and I'm going to be enjoying the penetration more versus other times I might have trouble getting wet. It might not, uh, my cervix is more sensitive to different positions.
100%. Yeah,
And I
so
don't think men don't realize that because
I
they're
don't
like,
think
oh, there's an opening and I can just go in there.
right.
And if I tell them, they're very respectful, but they always seem surprised.
Yeah, I think that if we as women aren't talking about it, then, and it's not, I mean, I think we need to talk about it more. I think that we need our partners to know that, hey, that's uncomfortable for me, or hey, we need this different position because that doesn't feel good. Or how can I change this angle so that I'm having pleasure with it? So sometimes if you are on your hands and knees, that's a really uncomfortable position. But if you can get your hips higher or lower, depending on the angle of your partner, that can be better and you're able to, yes, relax, like you said, and have pleasure with that because the angle is different. But I think in general, as a society, I would love for us to talk more about, hey, I don't like that. That doesn't feel good. Let's change it up because it doesn't. There are certain positions that aren't good for some people and aren't are good for others. And I think we need to talk about it so that we're all having pleasurable intimacy.
Yeah, I always say when women don't like sex, I think they're not liking the sex they're having. And sometimes it's their partner not tuning in, but sometimes like we don't want to offend the person, or we're like, well, if I say nothing and he just maybe he'll finish real quick and I'll be done. I don't have
Yeah.
to deal with upsetting him or ruining the mood or whatever.
Yeah.
And I think that we shortchange ourselves by not speaking up.
I 100% agree. And I think it's my mission that people will have pleasurable intimacy. That is my goal for every woman. I think that I want everyone to feel like it is exactly what they want and that it feels good.
I think that the men also need to tune in. I think they don't tune in as well in like a doggy style position. That's the one I have the most trouble with. I
Mhm.
tried what you said about putting my hips up higher, but that didn't help me. I think that's just a difficult position when the guy's kind of long and hard. If they're semi-hard, I have no problem. If they're average length, I have no problem. But the long hard guys, I have a problem. And I'm only 5'3". So yeah, but um and then let's see, what else did I want to ask you about? So, okay, maybe we can talk more about the cervix. Do you talk about cervical orgasms or something? Like, I'm very curious about these cervical orgasms because I've never had one, but my cervix, I noticed as I got older, it got more sensitive. And um, yeah, but it can also, that on the downside, it can also cause pain if it's like hit too hard in the wrong angle. And I know
Mhm.
every woman's cervix is different. And also, I don't want to compare. I don't like when guys are like, oh, this girlfriend I had and she squirted and she had all these orgasms. And then I'm like, I'm never going to fuck you because I cannot compete with that. And
Yeah.
if you're expecting me to be a squirter, a multiple orgasmer, orgasms here, orgasms there, like that's not me. It's kind of a turn on for me to have to like perform. I really like it more when we're just like in the moment and someone can enjoy me, what's happening, and our bodies are all different.
Yes, our bodies are definitely all different. I think everyone experiences pleasure in a different way. Some people, I mean, even just if we're talking just external stimulation, some people get pleasure from the clitoris being stimulated here. Some people get it from being stimulated on the side. Some people are totally unable to have an orgasm with internal penetration. If there's anything inside, sometimes that is an orgasm is off the table. And so I think everybody is different. And I think that I would want every person to know that even comparing between best friends and between partners, everybody is different and what people like is so different. And like you were saying earlier, I think talking about it and saying, okay, this feels good to me, this feels bad to me, I think is super important. And acknowledging that, yeah, what feels good to you feels different than what feels good to me. And I think, yeah, that's really important for everybody to know and acknowledge. And I also think in our society, we see things in the media. We see, oh, this is what it should look like. These people are experiencing an orgasm together. And that might not necessarily be the most accurate picture of what intimacy is for most people. I think an interesting fact is that most women, on average, need 21 minutes of foreplay to have appropriate lubrication. And often that is something that is brushed off by people, but that's a really important
Mhm.
number to note, 21 minutes. And I think not a lot of people are getting that much foreplay. And so that plays a role in what is the lubrication and how much pleasure is somebody having. And that affects, I mean, the whole vaginal canal, what the lubrication, the dilation, and the sensitivity. So that's a number to be aware of. And then about 80% of women need to have external stimulation in order to have any kind of orgasm. So I think there's a lot of pressure in what we see in the media of what sex should look like. And I think knowing that number, 80% of people need to have external stimulation is a good thing to know and take some of
When
the
you say
pressure off.
when you say 21 minutes of foreplay, what kinds of activities are you including in that?
I
Are
include
you
anything.
could it be like just kissing or
Yeah.
touching? Are you talking, are you including like um does this 21 minutes mean like he's going down on her and making her come? It takes her 21 minutes. Are you saying just like touching, cuddling, kissing?
Yes, that. Touching, cuddling, kissing, massaging, the lead up to
The
before
lead
anything
up.
is going internal or really even external. I would say before there is stimulation happening to the genitalia, 21 minutes before that. That can be a
I
massage, that can be like
mm,
we're cooking dinner and you're rubbing my back kind of thing, but 21 minutes.
wow. And guys don't need that. Guys get hard with the blow of the wind. They see a woman in a ponytail, their dick gets hard. It's so easy for them. And they don't know that we don't operate the same way. One of the things I love talking about on my channel is like the differences between men and women, because I think women will enjoy sex more if the men just slow down. But
Yeah.
they don't slow down because they don't know. We're not telling them they have to slow down. And it took me until my 50s to really realize what I like. Because in a lot of ways, I always made the man kind of the center of the experience because men kind of pressure us. If we don't say anything, they'll go at their own pace and they think that's what we like. And they're sometimes they're very impatient. They just want to get on with it, or they're if they're rushed or they're anxious or they just want to get on with it. And then it's really not that enjoyable.
Right.
So yeah, 21 minutes of foreplay. I
Yeah.
always tell guys, by the time you touch a woman's vulva, she should already be wet.
Yeah.
Because what they'll do, they'll get super excited and then they just want to like grope and touch. Even married guys, grope, touch, stick it in. And they're forgetting to, I always tell married guys like the sex starts the day before. You should
Yes.
give her a tap on the ass and walk away. Give her a kiss on the neck before you go to work and walk away. Don't just touch her when you want sex. Kind of keep the fire stoked because even if we try to get really quickly turned on, it just doesn't happen that way.
Right. I totally agree. I love the sex starts the day before. I agree. Yeah, I think, and I also think that the goal doesn't necessarily need to be an orgasm, but pleasure and intimacy. And so I think that can be different things for different people. Like you said, yeah, kissing your neck before you leave for work, or a slap on the butt, or I mean, cooking together, playing a game together after your kids go to bed. I think there are a lot of things that can be intimacy that can also lead up to intercourse and be foreplay, but also just be pleasurable and build the relationship. So,
Yes. And so I think for a lot of times, I'll say that for myself, when I didn't like the sex I was having when I was married or with men, I didn't know why, because everything is internal. Like guys can see everything. Okay, I like this, I like this, I like seeing my dick in your mouth. But I'm like, well, I don't like it and I don't know why. I'm not turned on and I don't know why. And until I could figure out why, I couldn't even say, oh, I like this different. I thought I lost my interest in sex 3 years into my marriage. And I went to this therapist to find out what happened to it.
oh,
And he asked me, do you masturbate? I'm like, oh, but I think it's why is it? I mean, I can't be the only one that had trouble figuring out why I didn't like sex anymore.
no, you're definitely not. I think that, I mean, I think our society has a lot of shaming, and I think there's a lot of what sex should look like and what it should feel like and what you should sound like and what you should be doing. And I think there's not a lot of talk about knowing what you like and then making sure your partner knows what you like. And that doesn't necessarily need to be with them. It's healthy for you to have an orgasm whether you're with a person or whether you're not with a person. Um, but yeah, I definitely hear a lot of people losing interest or feeling like they're not having pleasurable intercourse, even though it's not painful. And then they need to navigate, okay, what do I like and why is this not what I want it to be?
Yeah, I think that men really need to slow down and we need to tell them to slow down. Um, before we turn to the men, is there anything else that women come in with often or that you want to say about the ladies?
That's a good question. I think just know what you like, explore what you like if you don't know, and don't feel like it needs to look like anything you've seen or heard. And I also think that it's important that we do talk to our friends about what is going on, whether that is not having pleasurable intercourse or having pain with intimacy, because that shouldn't be happening, or leakage. There are so many things that happen that are kind of taboo to talk about. And so many people come to me after years of experiencing an issue because they don't know that it's an issue. They just, no one talks about it. And so they don't talk about it. And I think it's a disservice to women to not talk about it. So I think talk to your people about it, talk to your friends, talk to your doctors. If you feel like something isn't what it used to be, talk about it.
If a woman were to go to her medical doctor for like prolapse uterus or bladder leakage, it seems like I'm just thinking they would be like, take this drug, do this surgery. I don't think they would send them to someone like you to help her strengthen her muscles and find out really how to heal herself, I'm guessing.
Yes, I think it depends on the doctor. I don't want to say all doctors are like that, but in general, I think that it is. I often see people that have had surgeries because that was what they were told they could do. They didn't know there was another option. Um, I think when they've had surgery, but they haven't done PT before, they often have kind of a relapse because there was a reason they got the prolapse. There was a reason they had the leakage. And if you're not fixing the actual cause, if you're just having surgery, fix it, then you still have that root cause there. And so I see a lot of people that have had surgery and it didn't work for them. So I mean, I would encourage people, if you have an issue, if you think, man, I don't want surgery to be my only option, try to find something else. Because yes, pelvic PTs, we work on all of those things in the least invasive way possible. And research shows that it works. It really does help with leakage. It really does help with prolapse. It really does help with pelvic pain. You don't need to have those invasive surgeries or Botox or things like that. Try PT first.
All right. That sounds like good advice. Yes, I'm always trying something natural, right? Because that connects us more to our body.
Yeah,
And okay, now with the men, because I've seen men when I was an escort, I saw men. A lot of them had issues with their bladder, well, with their erections, their bladder, and their prostate. With the bladder, it was they if they had leakage, they would take medication. If they had issues with an enlarged prostate, they would take medication, and some of these medications interfere with the nerve somehow in their pelvic floor area to where they had difficulty with their erection or they had difficulty with an orgasm. And to me, as a woman, like it's not super hot to be with a guy who can't get hard, but the men, it really bothers them a lot.
that's
When
not.
their penis is no longer working, it bothers them a lot. And I'm like, why are they taking medication? Like, how did they get to that point? And sometimes with older guys, I'm just throwing a bunch of problems out. Sometimes with older guys, their penis is no longer pinkish, it's whitish at the tip. To me, that indicates like a lack of blood flow. Like, okay, you're not getting hard because there's no blood there. Uh, like it seems like a blood flow thing, but I really don't know. So, what problems have you seen with men? And you can just talk about any of this. I'll give you the floor.
Okay. No, I think I do see a lot of men that have urinary leakage issues, often with age or with prostate issues, whether that's if they have prostate issues or if they've had surgery to remove their prostate. That's a really common one that I see is that because let me pull out my model. Okay, so this is the bladder. Obviously, it is much bigger in real life, but your prostate, if you have a prostate, it is below the bladder here, and your urethra goes through it. And so when they remove the prostate, they're removing that much of the urethra. So that's a lot of muscle that used to hold in urine that is no longer there. And so a lot of times men have urinary leakage after a prostatectomy. So that's a big issue for them. And that's something that we can work on because we can do strengthening to strengthen the muscles, the other muscles that are still there to help them hold in their urine. Occasionally, I see people that have had a prostatectomy that have the opposite issue, like we were talking about tight muscles. And so, if the muscles are too tight after surgery, then they aren't getting full closure of the urethra. And so, then leakage can come out in that way. So, in that case, then we're working on lengthening and stretching those muscles. So that is something that I see a lot. And then in general, I see a lot of pelvic pain. So when a guy has a urinary tract infection, the muscles around that can get really tight, and that can include the legs, the abdomen, the hips, and the pelvic floor muscles. And so often I'm seeing people after they've had an infection and we're working on stretching and lengthening those muscles. It all really does, like you were saying, it really does come down to blood flow. That's a huge issue for people. If you don't have good blood flow, then you don't have good sensation, you don't have good pleasure, and you also, if you don't have good mobility, you lose that blood flow too. So I am doing so much stretching with people and a lot of strengthening with people. And if I'm not strengthening the pelvic floor, we're often working on strengthening the hips or the core so that they have stability of the pelvis so that the pelvic floor muscles can move how we want them to move.
Hmm.
That was a lot.
So, okay, so yeah, if the pelvis, okay, so if the pelvic muscles are not strong, and I work on that, like I've worked on that in Pilates, so I know what you mean, then other muscles have to compensate, right? It could be your back. You're
Yep.
saying it can also be this layer of muscles.
Yeah.
Pelvic floor muscles are compensating for weak abdomen. I see some of these elderly people and they can't even walk upright. I know their core is weak.
Yeah.
They're holding onto the grocery cart or whatever because they can't even support their own weight. It's kind of sad to see.
That
Is
is
that
that
an
is definitely
example?
that is an example. A lot of times those people, they A can have really weak glutes because that doesn't, so those muscles aren't holding them upright. But then the other thing is if they have back pain, that's a position where their nerves have more mobility and more room to move through their length. And so that's a pain-free position. That's actually, we call that the shopping cart sign. And that is a test to say, oh, yeah, okay, they have this issue with their back. But it is often something that could be improved if they had, yes, stronger glutes and stronger core. But like you were talking about, so I see people, yes, with pelvic pain a lot, but even if they don't have pain, if the muscle of the pelvic floor, so say your core muscles, your abs right here, the six pack ab muscles aren't as strong as we want them to be, these muscles get tight to provide that stability. Or if your glutes are weak on one side or both sides, if you don't have that strength to provide that stability with functional movements like walking or running, then these muscles in the pelvic floor will often get tight so that they can hold everything kind of together and get you the function that you need. And so then people can have issues. Maybe they develop constipation or they have urinary leakage or they have pain because these muscles aren't moving how we want them to. So, like you were saying, yeah, so I stretch these muscles with them and then we work on strengthening everything else around it so that they can have the pelvic muscles focus on the pelvic function and the glute muscles focus on that glute function. And that's a big thing that I'm working on with people is, okay, let's get your butt stronger. It seems like you're coming in because you're having urinary leakage, but what's actually weak is we need to strengthen the glutes.
Wow, that is fascinating. Who would ever think that?
I know it is kind of a weird train of thought, but yeah, it's a big thing that I work on with people and yeah, it works. I think it seems confusing at first, but it really does work.
Yeah, I know that just from my Pilates instructor and the movement specialist I went to and the massages I've had, I've learned that, I could have a tightness here, but it could be coming from here, like because the body's all connected.
Yep.
And I also learned that if my hip mobility, if my hips are not strong enough, if my muscles around here aren't strong enough to support my hips while I'm running, then my calves have to support, they have to stabilize me. And that's why my left calf was so tight, because this left hip was not, my glute was weak.
Yep.
Yeah,
Yeah.
so it's all very connected. And so many people are so concerned about, their sexual function. Oh, I need Viagra. Women lost their libido. But I think it sounds like a lot of it just comes down to not having been taught anywhere in school or anywhere about our pelvic floor and the muscles and the importance of good blood flow.
Yep. I totally agree. I 100% agree. I think that even in PT school, we weren't taught it enough. I think it is something that we need society to learn about more and doctors to know about and patients and friends to know about. So if someone came to you, you could say, oh, yeah, that sounds like this is the issue because everyone knows, okay, if you hurt your knee, maybe PT would be helpful. But people don't necessarily think, oh, well, you have urinary leakage. Maybe you should see a physical therapist, but we can help.
Right? They think about taking a medication.
Yep. Yeah.
Uh, I didn't bring my phone to see how we're doing on time.
It's 117.
Okay, so I can ask you like a couple more
Yeah.
questions. Okay, so going back to the men, uh, is there anything that could be pelvic floor related when a man has premature ejaculation, which to me always I thought comes from some kind of anxiety? I tell them to relax their muscles, relax and breathe, and it helps. Premature ejaculation or erectile dysfunction, which to me usually comes from like poor blood flow or a medication that's interfering with their nerves. Is that an area that you help men with? Or
Yeah, so when someone has, yeah, when they have erectile dysfunction, it can be that if we work on strengthening the pelvic floor, it brings more blood flow to the area, like you were saying, and then they can, yeah, and then that can help with the erectile dysfunction. There are some things, some nerve-related things that do cause issues with erectile dysfunction that I can't. If someone had like a nerve disorder like Parkinson's or something like that, that's not something that I could fix. But there are sometimes that there are cases with ED that people can improve with, or when people have had a prostatectomy, a lot of times they have erectile dysfunction or issues, and that's something that pelvic PT can help with as well. Um, yes, there's something else that you said that I wanted to talk about, but I
premature
can't remember.
ejaculation?
Yeah, so that is something that's not something that pelvic PT can really help with. That's more of, like you were saying, kind of calm the nervous system down and recognizing, okay, I can relax these muscles. So in that way, we can help with that. But for the most part, that is yes, okay, distract yourself, think of something else, think of chairs, think of something, anything else, and relax the pelvic floor. So the breathing can be really helpful, the breathing to calm the nervous system down. Yeah.
Yeah. So, okay. So let's see. Where can people order this wand or get more information about you? Or I don't know. You could write a book if you haven't already.
I
Um,
haven't. I would love to write a book. I would love for people to know all the things that pelvic PT can help with. And even if I saw no more patients for the rest of my life, I would love for everybody to know what we can do and how we can help.
I know
Yeah,
you're good at writing a book because you have a very fun, easy way of presenting all this information.
thank you. I appreciate that. I am in San Diego, so I'm Restore Pelvic Therapy in San Diego. You can find me here. So I have people call me if you have questions, and I want to make sure that you have the answers to those questions, whether that's seeing a pelvic PT, seeing me, or finding a provider near you or somebody else if PT isn't the appropriate route for you. So I always do those calls. I always want people to feel like they can get the answers that they need. And I think PTs have, feel like I have the luxury of time that I can talk to people and find the right resources for them. The pelvic wand, I typically don't suggest people use and buy for themselves until they've seen a pelvic PT because I have seen people in the past that did it without seeing somebody first and they injured themselves because you
Right.
have to be very gentle. So, but I will say if you want to, if you've seen a pelvic PT and you think this is appropriate for you, this is Intimate Rose, and it is a really good brand. I really like this brand. Um, and the dilators are the same brand. This is the brand I typically suggest, Intimate Rose. Um, and then the other thing we didn't talk about that I think is good for people to know is the Ohnuts. And this is a different brand that can be really helpful. But these are a device that can help decrease the depth of penetration, which can be helpful for women that do have pain with intimacy. A lot of times, people that have had a hysterectomy, this can be really helpful. Or if they just feel like their partner is hitting their cervix and it's not feeling good, Ohnut's. And then they come in a pack of I think five of them and they're stretchy and then they go on the base of whatever device, penis, and they decrease how deep it goes in. So
That's a good idea. Let's see. Oh, I guess I should ask about the hormone treatment somewhat too, because you approach things from a natural way. I mean, you and I did discuss, without me saying what we did discuss specifically. I know you wouldn't, but I don't want to say either. But we did talk about uh, hormone treatments for women that are part of what you also. What would be the benefits for that, and why would a woman need that? I always say menopause is not doesn't turn me into a patient.
I love that. I love when you said that is just, yes, exactly. I love that. It doesn't turn you into a patient. I will say that I see people postpartum, I see people perimenopausal, menopausal, people that have been on birth control that do have decreased estrogen in the pelvic area, in the vaginal tissue, internally and externally, and that can affect blood flow. The tissue can be thinner and they might have pain, they might have tearing. So a big thing that can be helpful is vaginal estrogen, and depending on where their issue is, that's where the estrogen would go. And yes, that isn't something that I, as a physical therapist, prescribe, but I can recognize when it's needed and say, okay, you should talk to your provider and see if they can prescribe this to you if they think it's appropriate to. But it is really good to help bring good estrogen locally. So it's not systemic, it's really safe and really local to wherever that estrogen cream is placed. And it really does help with blood flow. It does help if the tissue is thin. It helps if the tissue is, people sometimes describe it as dry or itchy or burny. I think dry is even with intercourse, even when they feel really lubricated, they'll say, oh, that feels really dry. And that's often decreased estrogen. So they can talk to their provider and get it prescribed to them. And it can also prevent UTIs.
Oh, okay. Yeah, we talked about that. And then also, I think what's common for women are people as we get older, like our skin gets more dry. and that vulva tissue, the external area can get more dry. So I've talked on my channel before about like this rose balm product that I
Yeah,
use. Yeah, and you recommended vitamin E oil, which I ordered, and that actually works pretty well.
good.
Vitamin E oil, it's not as expensive,
Yep.
but yeah, I always look for natural things when I can.
Yes, I like the natural route. I think that the estrogen creams and the other creams and moisturizers are good and they are appropriate when they're needed. I see a lot of people after they've had cancer treatments and they really do need some intense moisturizing creams, but those can be expensive. And so I like the vitamin E oil as an alternative or as a, okay, do the expensive one and then the vitamin E oil. So,
Okay, well, great. This is so much information,
yeah, thanks for
such good
having me.
information. Yeah, so I'll put your website in the description of this video, and hopefully, if people have questions, you guys leave the questions in the comments, and let's
Yeah,
see if we want to schedule, see if we can get Ariel back for another interview if you guys have questions.
yeah, totally. Thanks for having me and letting me share all my nerdy information that I love to talk about. It's so good for people to know. So thank you.
Yeah, thank you so much.